What do I need to know about impairment-related work expenses, or IRWEs, for professionals? Presented by Granite State Independent Living's Financial Planning and Benefit Services. What are impairment-related work expenses? Impairment-related work expenses, or IRWEs, are expenses that relate to someone's disability which are necessary for them to go to work. IRWEs are subtracted from gross earned income to reduce the countable net income that is used when calculating eligibility for benefits. What makes something an IRWE? Lots of different expenses can qualify as an IRWE, but they must meet all 5 of the criteria listed below. The items or services enable the person to work. They need the items or services because of a physical or mental impairment. They paid the cost and are not reimbursed by another source such as Medicare, Medicaid, or a private insurance carrier. The cost is reasonable, that is, it represents the standard charge for the item or service in their community, and they paid for the expense in a month they are or were working. What kinds of things count as IRWEs? Prescription drug costs and copays, doctor visit costs and copays, modifications to a car that are needed for a disability and so someone can go to work, attendant care services that help in the workplace or to prepare for work, modifications to the outside of the home to enable an individual to leave in order to go to work, modifications to the inside of the home that enable them to work at home, medical devices such as wheelchairs, pacemakers, and other equipment, also known as durable equipment, service animal expenses, and medical supplies such as incontinence pads, catheters, and ostomy bags. What are the rules of using transportation for IRWEs? IRWEs can be used for the cost of modified vehicles, such as wheelchair-accessible vans, vehicles with hand controls, etc. For miles traveled to and from work in that vehicle, the federal rate applies, and in 2014 it's 56 cents per mile. And for repairs and modifications needed to access the vehicle for transportation to work. IRWEs can also be used for other transportation services, not including public transportation, if special transportation is needed because of his or her disability. For example, an individual cannot use public transportation because there is no wheelchair access and does not own a modified vehicle. The cost of using an unmodified vehicle to transport that person to and from work can be used as an IRWE. If there is no private unmodified vehicle available, all other forms of transportation, such as a taxi, can be deducted. Please note that the rules about using transportation costs for IRWEs are complicated and based on many factors. It is strongly recommended that individuals interested in using transportation IRWEs discuss them with a Social Security representative prior to attempting to claim them. How do I help my client track IRWEs? When someone uses IRWEs to reduce their countable income, they need to keep all of their receipts so that they can prove that they actually spent the money on items or services that have been approved. If they don't keep the receipts, it's possible that they can have the IRWEs denied. How do IRWEs work for someone on SSI? In the SSI program, the cost of the IRWEs can be deducted from an individual's gross earnings. IRWEs will reduce the total countable income that is used when figuring the SSI cash payment. I've heard about BWEs. What are they? Blind work expenses, or BWEs, are out-of-pocket expenses that help you earn income similar to IRWEs. Unlike IRWEs, they do not have to be related to blindness. Any expenses that someone has that can help them work can count as IRWEs, as BWEs. In addition to examples of the IRWEs listed above, BWEs can include federal and state taxes, meals consumed at work, transportation, uniforms, and childcare. The individual must have paid for BWE items out of pocket and not have been reimbursed by anyone. You must be receiving SSI because you are blind in order to be eligible for BWEs, and BWEs are only for the SSI program. My client receives SSI and is blind. Should they use IRWEs or BWEs? Can they use both? You cannot claim both IRWEs and BWEs. If someone is an SSI recipient and is eligible for BWEs, they should always use BWEs instead of IRWEs. Items that are IRWE eligible are also BWE eligible, and BWEs reduce countable earned income more than IRWEs do. Because of the way that the Social Security calculation is put together for SSI, only about half the value of total IRWEs are applied toward reducing countable earned income, whereas the total value of BWEs apply to reducing countable earned income. Here is an example of what BWEs look like versus what IRWEs look like. An individual with a visual disability has expenses totaling $200 that could be considered IRWEs or BWEs. She is eligible for the full SSI amount and makes $500 a month at a job. So on the left-hand column, you have what impairment-related work expenses would do for her, and on the right-hand column, you have what BWEs would do for her. So if you look at the left-hand column, the impairment-related work expenses are deducted before the divide by 2 piece of the equation, so they're only worth about half the value. So that leaves her adjusted SSI payment at $613.50. And on the right-hand column, the BWEs are the last thing deducted. So they're not half, so she gets the total value of the BWEs. And that leaves her with a $713.50 SSI payment. So she ends up with $100 more by claiming these expenses as BWEs versus IRWEs. How do IRWEs work for someone on SSDI? In the SSDI program, the cost of IRWEs can be deducted from an individual's gross earnings. IRWEs will reduce the total countable income that is used when Social Security determines if they are working a substantial gainful activity, or SGA. IRWEs can also be used to reduce countable income below SGA so that they can keep their SSDI check. Can IRWEs be used for Medicaid? Yes, they can. Aid to the Permanently and Totally Disabled, or APTD Medicaid, and Medicaid for Employed Adults with Disabilities, or MEAD, both include IRWEs in their calculations for eligibility. MEAD also uses IRWEs to lower countable net income and premium calculations. I have a client on a HCBC Waiver program. Do IRWEs count for them? IRWEs are used to reduce net countable income when calculating cost of care for these programs, if someone is eligible for Medicaid through the APTD program. IRWEs do not apply in the cost of care calculation for HCBC IHS. HCBC CFI does not have a cost of care, so IRWEs do not apply to this program either. My client is on cash assistance. Can they use IRWEs? IRWEs are not used for APTD cash assistance calculations. If someone is receiving cash assistance and goes to work, the following exclusions apply. There's a $20 earned income disregard, then they deduct $30 or half of the remainder, whichever is smaller, and there's an employment expense disregard, or EED, of $18 or the actual expenses if greater. The EED is different than IRWEs, and different things qualify as EED deductions, such as Social Security and federal withholding taxes, transportation to and from work, and to and from childcare if the childcare is needed for work, childcare costs if needed for work, special clothing costs, and other mandatory deductions. My client's family receives TANF and FANF benefits. Do IRWEs apply to them? The TANF and FANF programs, also known as Temporary Assistance to Needy Families and Financial Assistance to Needy Families, they do not use IRWEs. They do provide special disregards for earned income, and your client should speak with their family service specialist at Health and Human Services for more information. Want more information? You can view the rest of the videos to learn more. You can contact Granite State Independent Living for assistance. You can visit the New Hampshire Work Incentive Resource Center. You can contact the Social Security Administration or New Hampshire's Department of Health and Human Services. And if you are connected with an area agency, a mental health center, or for vocational rehabilitation, you can contact them.